Good afternoon, everyone. Welcome to another session of TMAS. Hope I'm audible to you all. I'm Dr. Pooja, your host for the session. For the kind attention of the participants, the webinar will be recorded. You can access it on our YouTube channel. The link will be shared after the session. Please save your questions until the talk is done. We will have a question answer session towards the end. Without further ado, let's start. It is with great pleasure that I introduce our distinguished speaker for today, Dr. Antonio Paul. Today, Dr. Antonio will share his experiences of the intricacies of setting up a state-of-the-art transplant immunology and molecular diagnostics lab. Before that, a brief introduction on him. Dr. Antonio is a seasoned healthcare professional, currently serving as a consultant in transfusion medicine at the renowned Medical Trust Hospital in Kochi, Kerala, where he has played a crucial role since June 2018. In addition to his role as a consultant, Dr. Antonio has taken on the responsibility of Clinical Safety Officer, a position he has held since February 2022. Moreover, Dr. Antonio is at the helm of the Advanced Center for Transplant Immunology and Molecular Science as its head since June 2023. His educational journey is equally impressive, holding an MBA in Hospital and Health Systems Management from the prestigious Birla Institute of Technology and Sciences, Pilani. He earned his MD in Transfusion Medicine from the esteemed CMC Vellore, Tamil Nadu, and his MBBS from Jubilee Mission Medical College, Thrissur, Kerala. Dr. Antonio is also a certified patient safety officer, a certified professional for quality implementation in hospitals, a certified internal auditor for ISO 15189 2022 Medical Labs Quality Management System, and a certified professional for hospital infection control. We extend a warm welcome to you, sir. Handing over this virtual stage to you.
Yeah, thank you. First of all, I thank Transfusion Medicine Academic Society office bearers to give me such an opportunity to share my experience. And thank you, Pooja, for your nice words. So straight we'll go to our presentation. So is my presentation visible? Can somebody acknowledge?
Yes, please go ahead.
Okay. So, so the topic for today's discussion is setting up experience sharing session on setting up a transplant immunology and a molecular diagnostic lab. So these are the topics which I'll be covering or giving insights into today. So we'll go into introduction and the background and overview on what is meant by a molecular lab, what we are supposed to do, or what are the facilities that we need to establish a molecular lab, and what are the challenges that I faced during my journey, and what are the key learnings which I got during this journey, and a few management principles, and finally ending up with conclusion. So a experience sharing session, what is meant by it? It is mainly to facilitate the exchange of insights, knowledge and lessons learned from specific situations or project. So here the main motive of an experience sharing session is to share knowledge, to make others about various learning opportunities, to share various problem solving situations and how we solved it, to develop networking and also skill development, team building, and motivating others and inspiring others to do such journeys. So a brief introduction on my background. I did my UG from Jubilee Mission Medical College, which I think it played a very key role in taking up the transition medicine as my postgraduate subject, because when I was doing a house surgeon. When I was doing my house surgery in Jubilee Mission Medical College, already that medical college was having a full-fledged, fully equipped transfusion medicine department led by Dr. Sushila. She is very dear to me. We call her as Sushila ma'am. So Sushila ma'am and Rafi sir was already there. So they played a key role in helping me or taking me into the field of transfusion medicine. And after that, I went to CMC Vellore where I did my PG. And after that, we immediately after passing out, I joined in a medical trust hospital, which is located in Kochi. It is a tertiary care hospital functioning for about 5 decades. So it is a 750 bedded hospital, primarily catering trauma patients. And we also does around 150 to 200 kidney transplants a year. So moving on to transplant, every month as a part of these transplants, my nephrologist or my transplant team sends around 100 to 120 CDC cross matches along with other wide range of transplant immunology tests like HLA typing, donor specific antibody testing, flow cytometry cross match, donor lysate cross match, etc. So all these are transplant immunology related tests. So one problem which I came across when I joined this hospital was I found that the patients and relatives had to travel a long distance to other hospitals or other laboratories to give samples, and these samples are actually multi-level outsourced because one collection center will collect one sample from the patient and they'll send it to other their apex center, maybe either in Bangalore, Bombay, or Delhi, and they'll do as a pool of samples. And this actually took a lot of days. It may take around 7 to 10 days to generate the results. So also this multi-level outsourcing actually incurred high cost for the patient. So from this point, I got a thought that why can't we start an HLA lab or transplant immunology lab in-house facility? So because from that moment onwards, 2018 onwards, I was trying to convince management regarding the point or importance of having a transplant immunology lab in our hospital as an in-house facility. But the main challenge which I faced was I was very young in 2018 when I just passed out and I joined in this hospital. So it was very difficult for me to convince the management regarding starting this lab because the management was always been suspicious regarding how long this new joinee or a new consultant will stay in our organization or how many months or even how many years he'll stay. So it almost took me, and moreover the one doctor has to be gelling in with one organization or a hospital organizational culture, then only we'll start developing the credibility. So it almost took for me 2 years to build my credibility alone, and by the end of 2020 I convinced the management for starting a transplant immunology lab. But by that time I realized the fact that starting a transplant immunology lab alone is better idea is to make it as a full-fledged molecular lab because HLA typing in transplant immunology, HLA typing alone is a molecular test. Rest all other are serology or antibody-based assays. So for this HLA typing, since it is a molecular-based test, we need to have a extraction room. We need to have a template addition, master mix, PCR and post PCR too. So I thought anyway management has agreed to start a lab. So I thought I'll make it as a full-fledged molecular lab. So finally I convinced, and then the next challenge was finding an appropriate and adequate space because I asked for around 3,000 square feet space for establishing this lab. So again, our hospital is located in the city, in the heart of the Kochi town. So it was very difficult to find 3,000 square feet space. Again, finding space took around 1 to 2 years. And next was the most difficult part, convincing the management to spend a huge amount of money to convince them to spend. So already we have spent around 5 crores on this lab. So it was very difficult to convince them on spending this much amount. And we also did a meticulous planning. So it almost took 5 years to uh, come above the sea level. And 2023 February, we started our structural work, and April, our first technical staff, he was the technical head, he joined. And in July, all our 5 staffs joined, and we started molecular training for our staff because none of them were experienced in transplant immunology. So in July, we started our training of the staff along with the validation of the test. And in September we had blessing, and in October we started testing the patient samples. So these many things were done to convince the promoters or the management to spend on this project. So what we did is we gave a complete business plan. We split it into various phases. We did a SWOT analysis, strength, weakness, opportunity, and threat analysis. We did an opportunity and threat matrix analysis. We forecasted the number of samples that we are expecting for next 8 to 10 years in this transplant immunology. Then we gave an idea on how to enter the market. What is the detailed split upon capital expenditure? What is the amount of money that they have to spend and how much time it will take to recover the money? What is the break-even analysis? We did a full break-even analysis. We did, and we also suggested what should be the marketing strategy, what should be the value delivery process. Like this, we gave a complete business proposal for the management. And at that point of time, okay, they were like, okay, the team knows what to do and how to do. So these many things we did. We came up with a full business proposal plan. So from now onwards, it is the area of interest for the audience. What is meant by molecular lab and how we can establish a molecular lab. The first thing that we have to consider is a unidirectional workflow. The sample has to travel in one single direction. Once the sample has left one place, it should not come back to that particular place. So for molecular lab, we have various areas like sample collection or sample reception area, followed by nucleic acid, DNA or RNA extraction area. Then we have a reagent preparation and master mix separation area, followed by the template addition. Once you extract the DNA or RNA, that is called as template for further amplification steps. So we have to add this, mix this template along with the master mix. So we need a template addition room. Then we need a amplification room or a PCR room, followed by most of the tests will end in the PCR room, provided if we are using a real-time PCR machine where we can get the real-time data. If we are not using a real-time PCR machine, or we are using a conventional PCR machine, which is just called as a thermal cycler, the endpoint has to be detected by using a gel electrophoresis. So that has to be further analyzed in the post-amp analysis room. So the sample has to flow in the order which I have told. Once it comes in sample collection, it has to be transported to the nucleic acid separation or extraction room. After that, it has to be taken to template addition room. Meanwhile, the master mix has to be prepared in the master mix room, and both these has to be mixed in the template addition room, then proceed to amplification room, and then to post amp room. So this flow has to be maintained. Then the rooms has to be have a negative pressure setup, because the amplicons or the amplified molecules or the DNA particles can get escaped out of the PCR tubes once you open it. So it has to be very careful when we open the PCR post-amp PCR strips. So it has to be negative pressure rooms. Some rooms has to be positive pressure, like the master mix room has to be positive pressure in the molecular side, and the serology room where we do all the antibody based assay also has to be a positive pressure room. Then we need a wide range of equipments, starting from extraction. We need if you want, you can opt for a automated DNA or RNA nucleic acid extraction. We also have staff trained for the same. Then we need multiple biosafety cabinets, PCR hoods, laminar airflows, thermal cyclers. Then you need RT-PCR machines for various testings, kit-based assays. Then you have Luminex platform, which is mainly meant for HLA typing and transplant immunology antibody-based assays. So you need a wide range of equipments. You have to have even more equipments for CDC cross matching. You need to have a normal microscope along with an inverted phase contrast microscope. So you need to have a wide range of equipments for establishing a molecular lab. And the most important part is the staff has to be well trained. They have to be competent staff. And all these assays has to be validated, and the staff has to be fully trained. So I have listed many number of things that has to be noted while establishing a molecular lab. This actually, it is 3 slides. So I'll just go through it, and wherever it is important, I'll explain. So you need to have an idea on full list of equipments that you need. You need to have an idea on capital expenditure. What is the space that is required? What should be the material that we use for flooring, partitioning, and sealing? Because the floor has to be very seamless, jointless floor, which has to be very easy for cleaning. And the partition, you can use many materials. You can use calcium silicate boards, you can use brick walls, or even puff materials. All only thing is that it ranges from cheap to very high cost. And you have to take care of air handling unit, whether it is recirculated air or 100% exhaust air. So in our lab, we have taken care that our AC system is using 100% fresh air and the full air is exhausted. So there is no recirculation of the air. Then you have to have all routine equipments like fire sprinklers, smoke detectors, speakers. And another thing is important is water supply. You have to know what is the water supply, whether it is tap water or reverse osmosis or RO water, because for molecular grade testing you need to use type 1 ultra pure water, and you need to have equipment for this type 1 ultra pure water, and the input to this equipment has to be predetermined, because some equipments will demand to have a RO water and some will accept tap water. So if you have bought an equipment that wants an RO water or reverse osmosis purified water and you have only tap water, that will be a problem. Then you need to calculate, you need to have a full master plan in what all rooms, what all equipments are being laid out, and even the position of each equipment. So you have to know in what, in room number one or extraction room number one, what all equipments are there, and you have to calculate the electric load of each equipments. Then you have, for that you need to know the power rating of each equipment. You have to calculate it and give electrical department on idea, because you need to plan for UPS backup for all these equipments. Because it is a molecular lab, you need an uninterrupted power supply, so you need to have a UPS backup. So the UPS backup power has to be calculated with all these electrical equipments load. Then the room pressure has to be set up. Some rooms, as I told earlier, some rooms has to be positive pressure, some rooms have to be negative pressure. There are various guidelines on this. Most of the guidelines tell that the negative pressure has to range from -5 pascals to -15 to 20 pascals. It all depends upon how critical the test that you are dealing with. If you are dealing with a HLA testing, even -5 pascal will be enough. But if you are dealing with a infectious kind of testing, to be for example, if you're dealing with the corona or COVID positive samples, it is better to have -10 pascals. And if you're dealing with more infectious agents like Nipah or anything like that, it is better to have -15 to 20 pascals negative pressure. Then you need to have a monitoring system for all this: temperature, humidity, and pressure. You have to have an idea on what all, how many number of chairs, what is the height of workbench that you need to have. If you are standing and working, the height should be 90 centimeters, and if you are sitting and working, the height has to be 75 centimeters. Then, as I told earlier, you, before starting all the work, it is always better to draw the plan on the floor and see how spacious it is. But because once you start the work and after the end point you realize that my room is not enough, not spacious enough, then it is very difficult to change the plan or rework it. So it is always better to draw the plan on the ground initially before starting all the work and see how spacious it is. Then yeah, the all the rooms has to be airtight. No air leak should be there, because we are having negative and positive pressure in different rooms. So you have to take care of that, because you need to, you preferable, always it is preferable to use GI doors, because that will be airtight. If you are using aluminum doors, then you have to make sure the air is not leaked. Then you have to calculate the light that is required in each room. There are guidelines that each room has to have 300 lux of light. So you have to see how the light is being placed. You have to make sure that the light is not inappropriately placed, because sometimes when you place the light on the roof, it will go above the freezer or refrigerator. So you have to see a reflective ceiling plan. So there on the left side, you can see a reflective ceiling plan. So reflective ceiling plan is nothing but a full uh, picture on what all things are there on the roof. On what position you have a speaker, what position you have a sprinkler, what position you have a smoke detector, AC exhaust, AC supply, light, and all. So that you have a clear idea on what is seen on the roof. So it is always good to have a look at a reflective ceiling plan. Then you need to have pass boxes to pass the samples from one room to another room. Then always it is better to have a curved walls, not sharp edged walls, because once these amplicons leak out of the PCR strips, then it has to, then it causes very much problem, because it will cause contamination. Then from that moment onwards, you will get all false positive results. So you have to take care of cleaning process very tightly. So it is better to have a curved wall so that the cleaning process is very easy. Then you have to predetermine where the position of heavy equipments like -80 deep freezers, because you have to do a separate wiring for that. What is the position of pneumatic tube? What is the position of biosafety cabinets and all? Because each biosafety cabinet, there are different types of biosafety cabinet, class 1, class 2, class 3, and each biosafety cabinet external ducting is of different size. So if you don't have a clear idea on what is or where is the biosafety cabinet positioned clearly, then it is very difficult to uh, duct the biosafety cabinet to the external environment. So like that, you have to have a clear idea. Then what is a width of the corridor of the? We have designed our lab in such a way that we have a central corridor which is 2 meter wide, and all molecular rooms are on one side of the corridor, and the serology lab is on the other side of the corridor. So the corridor has to be of very good width, 2 meters, so that all the equipments can be transported through the corridor very easily. And also the rooms where we have big equipments like biosafety cabinets, deep freezers, and all, the doors has to be wide enough, preferably 1.2 meters. Then the we have biometrically closed doors. So because we have designed our lab like BSL 3 level lab, biosafety level 3 lab. So there are, I'll be coming into it, there are 30 numbers of items that you need to have in a biosafety level 3 lab. So this biometrically closed doors, then you have to differentiate between wet area and dry area. All water baths and all reagent preparation has to be done in one particular side of the lab. It should not mix up with the dry area of the lab. Then it is always preferable to have a digital monitoring system for pressure, temperature, and humidity. You have analog systems and digital systems. So we have opted for digital monitoring systems. So this is a range of labs that we have: biosafety level 1 to biosafety level 3, BSL 1 to BSL 4. And we have designed our lab to be a BSL 3 lab, which can deal with even mycobacterium tuberculosis, infectious agents. BSL 1 kind of lab is the one that we deals with the non-pathogenic organisms, and BSL 4 is a maximum top end spectrum where we can deal with Ebola and all. So on the right side, you can see 30 points which has to be which we have to have on a biosafety level 3 lab. So we have tried to incorporate all these points in our lab. Moving on to the equipments that we need for a molecular lab, we need to have a range of biosafety cabinets, laminar airflows, PCR hood. And as I mentioned earlier, there are various kinds of biosafety cabinets, and we have in our lab, we have class 2A2 and class 2B2. It all depends upon the amount of air that is recirculated and the amount of air that is exhausted to the external atmosphere. In class 2B2, we are having class 2B2, and in that, even 100% of air is exhausted to the they have a HEPA filter, and after HEPA filtration, it is exhausted to the external environment so that it does not cause any threat to even the outside environment, also to the lab staff. On the right side, you can see class 3 biosafety cabinet. It is also called as glove box. Only advantage is that it is having a double HEPA filtered exhaust system, and it is mainly used for by BSL 4 kind of laboratories. What is the difference between laminar airflow and biosafety cabinet? Biosafety cabinets has got exhaust system. As I told, it depends upon the class of biosafety cabinet, the amount of air that is recirculated and exhausted. Whereas in laminar airflow, there is no exhaust system. It is just a partition is there, no exhaust system is there. So I explained regarding all facilities that we need to have in a molecular lab. So it is like having a very beautiful football ground. Then we need players. So it is our staffs. So we need to train them properly. We need to do the test validation, make ensure that the staffs are competent enough to perform all these tests. So, but the real game starts when we start testing the patient samples. So it is then it all matters when the game starts, when how this ground and how our trained players help us to win the game. Moving on to steps of a molecular lab, uh, we have, first of all, we need to collect the sample or receive the sample, and after that we need to perform a nucleic acid extraction. So nucleic acid can be either DNA or RNA. For example, in HIV virus, the nucleic acid of the HIV virus is RNA, whereas in hepatitis B virus it is DNA. So you have to extract DNA or RNA. It can be performed either manually or by automated platform. Manually it is a elution technique, and automated platforms there are various techniques. We can have certain platforms offered by elution technique, certain other platforms offered by bead based technology. So once you extract the DNA or RNA, then it is called as a template, that because that is the DNA that is acting as a template for further amplification steps. Then parallelly we do a master mix preparation. Master mix is nothing but it is a mixture of chemicals like primers, nucleotides, Taq polymerase, and buffer. The primer is a specific one, because if we are using a kit that is designed to test a HIV virus or hepatitis B virus, the primer will be designed in such a way that it picks only the hepatitis B virus. It will be complementary to the sequence of hepatitis B DNA. If it is for hepatitis C virus, then the primer will be designed in such a way that it will pick or will attach only to the sequence that is complementary to the hepatitis C virus. So that is what is called as primer. It is actually designed by various companies. So once we buy a kit for particular testing, it will include everything. It includes primers, nucleotides. Taq polymerase is the enzyme that is used for PCR amplification, and it is this nucleotides which go and attach to the DNA or the template, and uh, that is how further copies of DNAs are being made. Then we have a template addition step where the extracted DNA is mixed along with the master mix, followed by amplification. So amplification can be done either as a conventional step or a real-time quantitative PCR. So conventional step, we use just a thermal cycler. It is not a RT-PCR. It's not a real-time PCR. So the problem is not the problem. The limitation is that in conventional PCR, at the end point, we will not be knowing whether it is amplified or not, whether the our point of interested DNA is there or not, whether it is present or not. So it has to be analyzed by a next step, where we does a gel electrophoresis. Whereas in a real-time RT-qPCR, we have a real-time PCR machine. It will show a graph. So real-time data we can see at what point of thermal cycling the copies got amplified, and also the real-time data. So most of the tests which we does on real-time RT-qPCR will end at that point. Only the conventional PCR test has to be undergone a post-amp analysis. It is done by gel electrophoresis. One thing to be noted is in HLA typing, the amplified DNA is then hybridized with beads. A company provides beads, and these beads are hybridized along with the amplified DNA. And after this hybridized beads along with the amplified DNA is fed into a platform called Luminex system or Luminex platform. And after Luminex analysis, we get MFI or mean fluorescent intensity from each beads. And it is based on this MFI reading that we get HLA typing or antibody assays. So this first picture shows just a one cycle of PCR. So we have a DNA template. It got denature. Actually, we are cutting the strands and we separating it into two different strands. So it got denatured. Then the primer of interest, because if we are using HIV testing, so the HIV primer comes and attaches to the if the HIV virus is there, if the HIV RNA is there, only if it is there. If HIV RNA is not there, this primer will not attach and further steps will not happen. So only if the virus is there, or the whatever is our interest, that virus is there, or that DNA or RNA is there, only then the primer will get attached. Once the primer got attached, the further steps happen, extension. That is that this constitute one cycle of amplification. Like denaturation plus annealing plus extension is one cycle, and 50 such cycles happen. And after this 50 cycle, many trillions and millions of copies of DNAs are amplified. So the second picture is the one that you can see in an RT-PCR machine, in a real-time qPCR machine. So here you can see the graph. So if suppose you saw that after 24th cycle, the graph got elevated, or the graph had a steep rise, which means that on the 24th cycle, the DNA got amplified. So the CT value or the cycle threshold value is told to be 24. The third picture is the same one where you have a template, and for after the end of first cycle you got two DNA, and after the end of third cycle you got 8, and after the end of the 32nd cycle you got around 4 trillion copies of DNAs. And that is on the right side bottom, you can see that is the normal thermal cycler, and in the one that is shown in the middle, it is a real-time or RT-qPCR machine. So during this journey, what all challenges I faced, I found it very difficult to build my credibility during my initial period, and it was very difficult to convince the management to spend on this project. And communication was very difficult because I used to talk in terms of science, or the language which I talk was science, and the language which promoters or the management was talking was economics. So it was difficult to communicate in a clear way. So that is why I decided to study MBA, because I thought if I have to convince them, then I also has to talk in economical way. So that is why I studied MBA. So, and initially I didn't had any support from my clinician counterparts, and always I was out of my comfort zone, and I found difficulty in balancing the family life in some stage of this project, because I used to leave from here by 8:30 and all. And during the structural phase of this project, I had many doubts, and I didn't had any consultants to consult with. So that was one difficulty, and getting enough number of staff was also a challenge. And the training the staff was also another challenge, because nobody was trained in transplant immunology. A few were trained in molecular techniques but not in transplant immunology, so we had to train. And another big problem was getting enough number of equipments, because I designed this lab, we have designed this lab as a full-fledged molecular lab, so we need to have a wide range of equipment. So the management or the promoters told that first you get the samples, then we'll provide the machine. So the other stakeholders, or where we go and ask to give the sample, they'll tell that first we get the machine, then we'll give the sample. So it was always like which to get first, whether to sample or the machine. So the lessons learned was building credibility always takes time, and you have to utilize each and every small opportunity you get during the process. And if you can convince the management to spend on this project, or whatever you think you can convince, depending on the data or the evidence that you have, and you should always be rational when you explain something. And the communication has to be very clear. It has to be in a perfectly structured way, so that the end other stakeholder clearly knows what we are meaning to communicate. And as I told, I didn't had any support from clinicians, so we realized the fact that sometimes you will have to swim against the currents. Nobody will be there to support you at any point of time. And only if you are out of your comfort zone, you will have a growth phase. And similar to told earlier, when I had a doubt during the structural phase, nobody was there to help me. So always you should not expect to have a guide with you. Sometimes you have to be your own guide. And getting enough number of staffs, initially it was very difficult, because I had to manage multiple staffs and multiple departments.
Antonio, no voice.
Hello.
Now go ahead.
Okay. So the key learnings, is my audio clear?
Yes.
Okay, okay. So the key learnings from this project, or my journey for this project, was we should have a proper effective communication. We should be patient, and whatever you think, you should be having a perseverance on that. And we always should be willing to learn new things and constant upskilling during our journey. We should accept our mistakes, correct it, and learn from those experience. And moreover, you should have the courage to tell no, or to fight for the point which you stand for if it is justifiable. So a few management principles, as I told earlier, the communication has to be very clear. It should be sharp and in a structured way. So always we followed a S bar protocol. So when you tell a problem or when you present a scenario to authority, you have to initially give a brief description on what is the situation, what is the background, then give an assessment from our side. What do you think the problem is actually? And give them a recommendation what is expected to do from their side or from our side to solve this problem. So you have to organize the thoughts very clearly, outline the information, and know what we are asking for, so that the crux of the matter is effectively communicated. Next is regarding leadership styles. There are various leadership styles. There are autocratic style of leadership, democratic style of leadership, and delegative style of leadership. So at various point of time, you have to be autocratic, and some point of most of the point of time you have to be democratic. Some point you have to be autocratic, and some point you have to be delegative. So it all depends upon the situation how you have to behave. And entire during this entire spectrum of project we had come across various conflicts, and this conflicts has to be managed in a different style. uh, a single type of conflict management won't suit all the situations. So sometimes you have to be collaborating and negotiating, sometimes you have to suppress the other person, sometimes you have to avoid the conflict itself. So it all depends upon the situation how you are handling it. And you have to have a constant or a very good negotiation skill to get various things done. So total now we have 9 staffs in our lab, and we have interviewed 46 candidates in total for this. And during the interview, we interviewed MSc candidates, PhD candidates, and BSc candidates. And what we came across is it's always better to take fresh minds who are willing to study or learn new techniques. We What we saw is MSc candidates and PhD candidates were already working in some labs in good positions, so they were not ready to learn new things. And since it is our first of its kind facility in Kerala, first of its kind transplant immunology and molecular lab in Kerala, we have to teach them a lot of things. So what we came across is taking BSc staff is always better. So we try to select candidates who have positive attitudes and also willingness to learn. Another thing to be mentioned at this point is we thought of creating an associative network model for our lab. So I'll explain a bit on this. The moment you hear the name Sony, you will remember either Sony Bravia TV or Sony camera. And even if the Sony means quality equipments, quality camera, quality TV. Likewise, if you remember, if you hear New York City, you'll think of 9/11, the Statue of Liberty, very busy city, museums, cultural attractions, and all. So we thought to create an associative network model for our lab. So we thought once you hear our lab's name or the name of our laboratory, then many things has to come to your mind, like high-end equipments, high quality report, excellent infrastructure, good coordination between clinician and laboratory staff, best turnaround time, well-trained doctors. So like this, you have to remember the moment you hear one lab's name, these are the things has to come to your mind, because mind is a network of nodes and connecting links. And in psychology, it is told that the associative memory is defined as the ability to learn and remember the relationship between unrelated items. So we, during submission of our business plan to the management, we had made a associative network model for our lab. And finally, our lab got blessed in 2023 September, and we started testing our samples in October 25th. And till date we have done around 120 CDC cross matches, and exactly 1 month from our patient testing sample, on 25th of November we did our first cadaveric cross match. So we are part of various organ donation programs, so we did multiple cadaveric cross matches. And if you can notice, the time in the clock is shown to be 2:15, and that is 2:15 in the morning, 2:15 a.m. And it shows the importance of the team building process, because all my staffs were enthusiasts to stay in the midnight in the lab for doing this cadaveric cross match. So these are the tests what we offer in our lab. We do CDC cross match, Luminex based transplant assays like HLA typing and antibody based assay. We have multiple RT-PCR machines where we can perform oncology testing and infectious disease testing. We have a syndromic disease testing platform called as BioFire. It is a nested multiplex PCR where we can test various panels like pneumonia panel, meningitis panel. So for pneumonia panel, the sample will be bronchoalveolar lavage or the sputum. So that will be fed into a cartridge, and in 1 hour you'll get the report what is the organism that is causing the pneumonia. Likewise, in meningitis, if you get the CSF, in 1 hour you can get to know what is the organism that is causing the meningitis. So we have multiple panels like that, and we also does NAT testing for blood banking. Our future plans are we are planning to get a flow cytometry soon, and in 1 to 2 years we'll try to get a next generation sequencing. But if it is maybe 2 years down the line, the NGS may become non-relevant. So what is relevant at that point of time, we'll try to get that technology on board. And we also have plans to start various training programs, fellowship programs, and we also have plans to go for research projects, ICMR granted research projects. This is the view of our lab. So as I told earlier, we have designed in such a way that we have a central corridor which is 2 meter wide, and you can see on the bottom photo view from the entrance. On the right side, you have all molecular rooms. So you have extraction room, template addition room, master mix room, and all. On the left side of the corridor, you have serology based assays, flow cytometry, CDC, cross match, and all. So these are the various references which we used during our project. We had used ISO 15189 along with NABL document 112. We also followed ASHI guidelines along with CLSI, Clinical and Laboratory Standards Institute guidelines, CLSI guidelines for our laboratory establishment. We also used NABH 5th edition guidelines. And to conclude, I have to thank each and every person that is mentioned in this list, because I couldn't have established this lab without help of each and every person in this list. My teachers, my colleague, my friends, various other doctors in different parts of country. And moreover, I have to thank my team blood bank, because only because of blood bank I could establish this molecular lab. Because if they had told you have to be here for the whole time, then I couldn't have established this molecular lab. So I have to thank my blood bank team as well as my molecular lab team. And I believe in these two quotations: difficult roads always leads to beautiful destinations, and another thing is miles to go before I sleep. So with this, I conclude my presentation, and if any question and answers are there, I can address.
Thank you, sir, for sharing with us your valuable knowledge. Next, we have a question answer session. If you have a question, you can either unmute yourself and ask directly or type it in the chat box.
Can I ask a question, Antonio?
Yes, sir. Yes, sir.
Any queries? You
Hi,
can
Antonio.
directly
I'm
ask.
Ankit.
There are some questions in the chat
Yes,
box.
sir. Tell me, sir.
Is this a central lab for Kerala, or is it a hospital-based one? Do you handle infectious disease or only HLA? I think it was mentioned. If you want, you can just clarify the same.
Okay, so this is not a central lab for Kerala, and this is also not a hospital attached lab. This is an independent lab where we have done separate registration in the corporation for a lab. If it is a hospital based or hospital attached lab, you need not have a separate registration legal document. So we have designed in such a way that it is an independent lab. So we did separate registration, and we are dealing with both infectious and non-infectious samples. So we have separate extraction rooms. We have 3 extraction rooms: one for RNA isolation, one for infectious DNA, and one for non-infectious DNA, which is HLA. So one for transplant immunology extraction, one for infectious DNA, one for RNA. So we have separate rooms. Only the extraction point you need to have a different separation. Once it is extracted, the nucleic acid is not infectious, or the infectivity of the nucleic acid once it is extracted, it is less. So only thing is that you can use the common facility for a master mix, template addition, and PCR and all. You can use the common facility, but it's always better to have different hoods, different PCR hoods or different biosafety cabins to deal with infectious and non-infectious samples.
There is one more query.
Yeah.
What is the minimum cost to set up a basic transplant immunology lab in Indian scenario?
Yeah, that is a how to answer that question. You can establish a transplant immunology lab with all basic setups and high-end equipments. So if you, and that too, it is two kinds. You can set up a serology based transplant immunology lab and a molecular based transplant immunology lab. Well, the moment molecular comes into play or comes into picture, the cost is high. The establishing a molecular plus serology based transplant immunology lab will come to around 1.5 crore. It all depends upon your negotiation skills, what price you are getting the equipments for, and how cheap or how good quality things you are utilizing for you setting up the lab. So it may range from 1 to 1.5, or even it can go to 2. And since we have designed in such a way that we are doing in the infectious part also, our budget has gone way beyond that. So I think the minimum, if it is only for serology, if it is only for CDC cross match, then the budget is low. Then it will be around 50, because anyway you need to have deep freezers, refrigerators, refrigerated centrifuges, microscopes, and all you need to have for even for CDC. So for serology based transplant immunology testing, then the budget will be around 50 to 70, maybe. Once the molecular comes in play, then the budget goes high. Ankit sir, you were asking something.
Antonio, you answered my question.
MBR, can you unmute and ask?
Yeah, Antonio, you answered my question. I was curious to know how do you differentiate your HLA samples and infectious disease sample? So that just now you answered this question. Anyways,
Okay.
congratulations, Antonio. Very nice presentation and the work you have done. Very impressive. Congratulations, Antonio.
Thank you, sir. And to mention, Ankit sir was one of the person who has helped me a lot during this journey, because I used to call him. Even I have visited his facility. I went for a training of 2 to 3 days in his lab. So my main motive was to see how the lab was established. So like that. So I thank Ankit sir also in this situation.
Thank you.
Anthony, can I speak?
Yes, please.
Yeah, very good presentation. One doubt, I don't know whether I missed it, you told it or no. See, negative pressures only for infectious samples, right? Otherwise, only HLA transplant, no need of negative rooms.
But it's all better to have a negative pressure room, because the amplicons, once you open the PCR strips, the amplicons are likely to get escaped. So that amplicons can cause contamination in the next step. So it's, even if you can't set up the negative pressure by using just a biosafety cabinet. If you have a biosafety cabinet in a normal AC room, that is fine.
Okay, I
Because
got it. Yeah.
so we did what we did is we did all the rooms itself as a negative pressure.
Dr. Rajesh, can you unmute yourself and ask?
May I speak, Dr. Nitin here?
Yes, sir. Yes, sir.
Yeah. Hi, Antonio. Excellent presentation and great work from your side. What I would like to know is, when you set up a molecular lab, how many samples will it take to have an operational profit from your end? So, what is your opinion about that?
Means you are asking regarding break even.
Yeah, breaking on exactly.
Okay, it depends upon how much number of samples you get. The more number of samples you get, the faster you reach the break-even point. So that is the main. That was one point that we found difficult in convincing the management. So we have taken a bail from them. Like we have told, it will take 4 to 5 years to become break-even. But since we have infectious also with the transplant immunology, it will take some more time because we are offering infectious testings also. Then so in that scenario we are getting more number of samples. So I hope it all depends upon the number of samples.
When are you planning to take samples from outside? Are you working on that?
Actually, we have established this lab as an independent laboratory, not attached to any hospital, and that is designed. We did it in such a way only to accept the samples from outside. But only one thing is that since ours is the first of its kind, and our staffs are also new, we are in a process of slowly. First, we have to get used to our in-house samples. Then my staffs has to feel confident with dealing with more number of samples. So our aim is to accept the samples 6 months from now, 6 months from October. We started functioning in October. So I assume I'll be accepting samples by May of next year, 2024.
And one more thing, Antonio, as if now a lot of national chains and even Reliance, everybody is investing in molecular laboratories. So, what is your opinion about future competition from the national players? And a massive consolidation is happening across the laboratory sector, from Metropolis, Lalpath, Vijaya. Everyone is consolidating. So, how do you look forward to take it forward?
Yeah, all this Metropolis, Lalpath, and all is offering, and that too, the molecular tests are being offering in a very competitive, very attractive rate. The only thing is that they have advantages the numbers because they have lot of collection centers across all across India. So they'll get the sample and they'll transport it to Chennai or Bangalore and they'll do it there. So we have a restriction of that. We can't get a huge number of samples and do it all of a sudden in our laboratory. But the thing is, what we offer is quality of the test and a good coordination. What I understood is there is no coordination between clinician and the lab. The clinician from a hospital sends the test to a particular lab, or not to mention a name, but all these corporate laboratories, and there is no interaction between the lab doctor and the clinician. So what at that point we offer a good clinical coordination between a lab and the clinical doctor, and a quality of the report. That is what we highlight. And down the line, it is definitely going to be a very competitive area in molecular lab because with the COVID coming into picture, everybody is no, till COVID, nobody was aware of RT-PCR test. After COVID, everybody knows what is RT-PCR test, or RT-PCR test is equal to COVID. So after that, even last week, I got a call, random call from a patient or outside person, just asking for a respiratory panel in our syndromic testing platform Biofair. So I asked him how you came to know. So he was Googling and he found that Medical Trust is offering, or our lab is offering a respiratory panel. And in that respiratory panel, COVID is also a part of it. And one advantage is that he'll get to know what all other, or if it is not COVID, what is the other organism that is causing the disease or the pneumonia. So people are also getting very updated on these things. So definitely molecular is booming area, and there are reports from USA and New York telling that the molecular industry is likely to have a boom to around $10 trillion. So we are also hoping to be a part of that boom.
All the best, Antonio. Excellent work. Anyway, you will have to face a lot of competition on the way, but all the best for your future.
Thank you, sir. Thank you. Thank you.
Sir, Dr. Saptarshi Mandal has raised his hand for a question. Sir,
Hi.
could you unmute?
Hi, am I audible?
Yes, yes. Please.
Hi, very nice presentation, Dr. Antonio. I was wondering the hoods that you mentioned, they are usually made for regular atmospheric pressure, right? Ambient regular pressure. So if you have negative or positive pressure, and if you put a regular hood instead of a custom hood, have you checked whether like suppose you have a positive pressure room for your clean area, and if you put a regular hood, which is like not a like horizontal but a vertical pressure hood, there would be a front curtain, air curtain, and if there is a positive pressure, the positive pressure, though it's a very slight positive pressure, but have you checked if it breaches the air curtain and goes into the hood? Do you get my
Yeah,
question?
we have, as a part of testing, we did a few tests with tissue paper at the air curtain level. So we found that it is not finding any difficulty, or it is not imposing any problem in working in the, because hood is mainly meant for personal protection, and it is not pressure. The PCR hood and laminar airflows are not pressure maintained. It is just a physical separation between the samples and the staff who is doing. And the room is the positive pressure rooms we have set at plus 5 Pascal, positive 5 Pascals. So we found that it is not causing any problem, because we tested by keeping a few pieces of tissue paper in the edge of the PCR hood, whether it is changing the air direction flow and all.
Right, actually you can use a agarbatti, I mean incense candle, and you can see the stream
Okay.
of the direction of the stream of the smoke. And
Okay.
that will be a more sensitive test than a tissue paper. So
Okay.
probably it will be a good idea to check whether the air curtain is intact or whether the room air is entering your hood, because in that case the you can have contamination. Though the like pressure 5 Pascal is very little pressure,
Yeah.
but sometimes these hoods, the inside of the hood is neutral pressure, and if you have outside is positive, then that air might enter the hood, which
Okay.
might need adjustment in the setting of the hood.
Yeah.
So
We'll
I'd be
definitely
curious
do
to
it.
know, yeah, whether if you do a test, let me know how it actually goes.
Yeah, I'll get back to you, sir. Thank you. Thank you.
Thank you.
That was an insight for us. We'll definitely do it.
Thank you.
Thank you, sir. Now we have a question in the chat box from Dr. Rajesh. The question is, are there any legal or mandatory approvals required for establishing such a lab? Also, are there any accreditations available in India for transplant immunology labs?
First, regarding the legal registration, only thing is that you need to have a corporation or any government registration. So we did a corporation registration. Only if you are doing any paternal testing or paternity testing, then you need to register under PND Act. So since we are not doing any paternal testing, we haven't done a PND Act registration. So we just have a corporation registration. Regarding the accreditation, we are in a process of going for NABL accreditation. For blood banks, we don't have NABL accreditation, it's NABH. But for a lab, it is NABL. So we are planning to go for NABL accreditation. Internationally, you can go for ASHI accreditation. American Society of Histocompatibility and Immunogenetics accreditation you can go for transplant immunology.
Thank you, sir. I hope there are no more questions. So as we draw near the conclusion of this webinar, I want to express our heartfelt gratitude to Dr. Antonio Paul for sharing his expertise and insights into the establishment of a state-of-the-art transplant immunology and molecular diagnostics lab. We extend our thanks to all the participants for their active engagement and questions, which have made this session truly dynamic and enriching. Before we part ways, a few reminders. A recording of this webinar will be available for your
Thank you all
on our YouTube channel. If you have further questions, feel free to reach out to us and stay connected for updates on future webinars and events. On behalf of ACTIMoS, thank you everyone for being part of this webinar. Have a great day and see you soon.
Thank you all.